Hello, everyone. My name is Rebecca Scharf, and I am here coming to you from the beautiful city of Charlottesville, Virginia, and I get to work there in our kids' muscle clinic, or our pediatric neuromuscle clinic. And there is where we have our certified Duchenne's Care Center. And throughout this presentation, I will show some photos of patients who have given me permission to take their picture and to share their photos, but some of them I've covered their faces just to keep for some privacy. But thank you for having me, and I wanted to say thank you so much to PPMD, and thank you also to Rachel for inviting me to do this. Is it too low? There we go. I'm really grateful for the fact that PPMD is so interested in hope and resilience, and how do we foster wisdom and kindness as we all live together in a neuromuscle community. I'm grateful for the opportunity to talk a little bit about what I've been learning about seeking wisdom and offering kindness. And I know that this is really a lifelong journey that I'm going to have to keep learning throughout the rest of my life, and I know that I have a lot more to learn. I also know that I learn so much from my patients, from my colleagues, and from all of you in this room about how to live a life that is filled with wisdom and filled with kindness. And so I wanted to talk a little bit about one journey that I've been learning through, and one particular aspect of care. So this began several years ago. I have a wonderful colleague whose name was Jim Plews-Ogan, and he was a pediatrician. He was a pediatrician particularly for children with special needs. So he took care of kids with medical complexity, he took care of kids who needed palliative care, and he was one of those pediatricians who was phenomenal at what he does. He's beloved by the whole community in Charlottesville, and he was able to provide care to the most vulnerable of children, to the children who needed the most support. It was wonderful to watch him in action. And several years ago, unfortunately, Jim was diagnosed with ALS. And this was devastating to all of us, Jim particularly, and also to the whole community within pediatrics who knew and loved him. And I was so grateful for the ways that he lived his journey and shared it with us, and I learned a lot from him along the way. Let's see. Jim is seen here with his wife Peggy. She's wearing yellow, and she is an internal medicine physician. And Jim and Peggy, as they would go to ALS or to neuromuscular clinic visits, they found that every time they went to clinic visits, the clinic very carefully documented just what Jim couldn't do anymore. They found that every time they went, they took motor measurements and they said, all right, here's what you've lost this time, or here's what you can't do anymore. And Jim and Peggy said, yeah, that's probably true. However, what about all these amazing things we have actually learned while living with a progressive neuromuscular disorder? And I think that Jim and Peggy approached this very wisely, their journey. They kept saying, but wait, we've got all these superpowers now. There's things that we never thought we'd have to know how to do that we can now do. And they were really good at stepping back and saying, all right, what wisdom have we gained here? What are the ways that we have changed? How have we adapted? And also, what are the ways we can show kindness to others who are now living this journey as well? So I really appreciated the chance to learn from them and watch them go through this journey. And so Jim and Peggy and their family decided to find a way to highlight these new skills and perspectives that they were gathering. So they began to take notes. What are the wisdom, the perspective, the humor, the flexibility, the ingenuity, the patience, the passion that we need to live with a progressive neuromuscular disorder? And I really appreciated the ways that they took this on, and they decided to focus on the strengths that they had, these new superpowers. And so they called these the attributes of the turbocharged life, or turbocharged living. And they really wanted to highlight these strengths that they learned. They also wanted to highlight them in others, though, because they found that it wasn't just them, that many patients who are living with any chronic medical condition or a progressive neuromuscular condition do have these new perspectives that they've gained along the way. And so throughout his battle with ALS, Jim kept an online blog called Offering Kindness. And it was really meaningful to so many of us who knew Jim. We learned a lot from his perspectives, we gained a lot from his wisdom, and it was really helpful to me to be able to know what was happening in his mind as he went through this journey. And so then he and Peggy wrote a beautiful article called Seeking Wisdom, Purpose in the Turbocharged Life. And as a result of this journey, they began an organization called the Hummingbird Fund, and that provided support and resources for patients and families who were living with ALS. And so as I watched Jim and Peggy go through all these things and offer up what they were learning to our community and really provide a lot of reflection and a lot of wisdom during their journey, we decided that we would take this turbocharged living tool that they created and also use it in our pediatric neuromuscular clinic. So we decided to use this with our patients with Duchenne and with SMA. And so the turbocharged living tool allows patients and caregivers to reflect on the experiences of living with a neuromuscular condition through a variety of statements. And you can check all that you apply. So you guys just tried some of them. Thank you. And you can check all that apply, or you could rank order them. You could say, here's where I am first, second, third, fourth. And the point is not so much where are you as much as to help you think about, hey, what are these things that I now have? Or what are the ways that I've been changing? Or what have I been learning along this journey? And it allows people to reflect on, hey, what are my superpowers as I navigate everyday life? And so every week I'm amazed by all that I learn from my patients. And so particularly ways that patients continually adapt. And I know that one of the questions we just answered was, how have you been adapting? And I know a lot of times, depending on where you are in your journey, you are adapting in ways you never even thought were possible. And I see that all the time in my patients. Recently, I had a patient who came to us as a refugee from a war-torn country, and they came new to the United States. They were learning a new language, a new culture, navigating a new medical system, and along the way, their son had routine blood work which found elevated numbers for his liver tests and for his muscle enzyme. And he was diagnosed with Duchenne muscular dystrophy. And I can't even imagine what that would be like, moving to a new country, new language, new culture, and having to navigate a new diagnosis of Duchenne. And I was just amazed at how they handled that with such grace, with such strength. And it's such a privilege for me as the Duchenne doctor getting to watch my patients and see the ways that they handle things in ways that I never thought I would be able to. Another great privilege of my job is learning from my patients as they make me laugh every week. And so I feel like one of the highlights of getting to be a physician in neuromuscular clinic is that my patients bring me a lot of joy and a lot of laughter. And I really appreciate it. I think this is also special to working in the pediatric field, although I do see adults as well. But I think sometimes I get a lot more of the funny parts of life, and I appreciate that. I think families who really lean into the humor of their situation sometimes can teach me a lot about living with grace. Some of my most humbling moments as a doctor come in watching patient kindness. And I really feel like I have been blessed to see kindness really shine through in a lot of the kids and families that I work with. And in our clinic, we offer parent awards. So we have been so inspired by so many of the amazing caregivers in our clinic that periodically we'll all run into a room and provide a parent award or a caregiver award for a family who has been going above and beyond in their daily life. And here is one of our families who just have really inspired us with their kindness. They're always checking in on other people. They want to know how the medical team is doing. They want to know how they can help provide support to other families. And I really feel like kindness is a way that our patients inspire us as the medical team to really continue to learn and support one another. Here's another photo from another parent award from our clinic, and this is an example of compassion. So this family participates in clinical trials because the mom always comes to me and she says, you know, we really benefited from the science that went before us. We really benefited from the clinical trials that allowed for different things to be known about my child's illness. And so we are now going to participate in clinical trials because we want to pay that forward. We want to take what we've been given and continue to help others learn. And I've just been so impressed by her compassion for others, and I think that that's another thing that I've been able to have the privilege of watching from the sidelines as a physician. I think Rachel Callender is here at this conference, and when I first heard her speak at a PPMD event, I loved hearing about her similar tool. She had a tool for her daughter called Evie's Awesomeness Scale, and I think that's very similar to this. And in learning about her work, when I heard her speak several times, I have found that she was looking for the superpowers of kids who are living with genetic variations. And I think that's just such important work and really highlights the hopefulness within this community. There's a lot to be hopeful for. And I also really appreciated hearing Dr. Friedman speak yesterday, and he talked a lot about his journey with hope and how that can make such a difference in how patients approach medical care and also how they approach living in their community. It's really inspiring to me to learn from people. This turbocharged living tool notes that at any given time, patients could be in different places in their journey. So there's not a right answer or a right place to be or somewhere where you have to strive to be. It's just a way to reflect on, hey, what are the skills that I've been learning along the way, and where are the places that I can pause and reflect or look with some perspective on what I've been gathering along this journey here with living with neuromuscular disease. As a Duchenne doctor, another amazing privilege that I have is a front row seat to the resilience of the human spirit. I'm continually learning new coping strategies for my patients, and this patient and his mother just taught me so much, filling my heart again and again with how they would get a new challenge or have a new setback in his medical care, and they would stop, pause, think, and then reflect on how they could learn from that and also how they could help others because of that experience. And I felt like they came back stronger each time they had a new medical challenge. And so it was such an honor to watch their resilience in action, and I can't tell you what a privilege it is to be in these clinics. Altruism is another thing that I get to see over and over and over again, and I know all of you in this room also get to see this. And so I have patients who volunteer their time, who work so hard for various things. I have patients who volunteer in nursing homes, who help people find tools in the hardware store. I have patients who give historical tours and teach people about the important aspects of history. I have patients who run fundraisers and patients who advocate in legislation and who have fundraising events and help run races, and who also provide really quiet, unnoticed care day after day for many other people. And I really think that it's this altruism that keeps us all going and allows us to continue to learn from one another. As I've spent time over the past 20 years in this field, I think passion for creating change is one of the attributes I keep finding so inspiring. And I know I'm preaching to the choir here, who more than PPMD is incredible at passion for creating change. So thank you to all of you in this room who work so hard to create change and keep making improvements in the lives of patients and families. And I see this every day in the families I take care of, and in their ability to really buckle down and try to make the world a better place. And so I'm really grateful for that. I see a brighter future coming, and I love that this comes to light as I get to talk with families about this. I also learn a lot about tenacity, fierceness, motivation, spunk, all sorts of great things from my amazing patients. And they share their stories with me, and I wish I could sit and write them all down. I feel like I've been learning from this wonderful community for over 20 years now, and the fierceness with the way my patients tackle their daily lives is really inspiring. The final set of topics in this turbocharged living tool allows patients and caregivers to consider the ways that they learn, they grow through participation in this neuromuscular community, and through the ways that they continue to tackle life as they have new medical challenges or that they are speaking with different medical providers. We also created a child version of the turbocharged living tool, and that it can be we can complete it orally, so we can read some things to a child and allow them to choose amongst a variety of answers. And so that's been fun to be able to use with children and youth, or for patients who might not be able to read or write on their own. Another area I've learned so much more about is advocacy, and particularly through sports. I find that some of my patients have taught me a lot about participation through sports, particularly power soccer. Many of my patients have enjoyed, and I've loved learning about it. I've loved getting to watch it, and watching patients and their families do teaching of others, inviting others in. It feels like such a neat way to provide community coaching, mentoring, and teaching, and that's just taught me a lot about advocacy, care, and concern in this community. I also love to see the ingenious ways that the neuromuscular community works to make living and thriving with neuromuscular disorders possible. I've learned a lot from my patients and families over the years about creative ways to have ramps and lifts and college dorm room hacks and ways to get to work, ways to participate in various activities and different clubs and ways to make joining a community easier. I've learned a lot about going to college with neuromuscular disorders, and I think that our patients have done such a beautiful job of teaching me about that, and that's something that I love when they stop and tell me about. I feel like ingenuity is one of these virtues that really shines through in the neuromuscle community. We end each neuromuscle visit asking about hope and satisfaction with life, and these visits have given us a lot of hope from our patients and families, and also insight into the skills that they're gaining each day. In our follow-up questions after this pilot study, using this turbocharged living tool, we found that about half of patients only had reported that they had been previously asked about strengths in a prior medical visit, and that 70% thought that it was helpful to use this tool to provide some insights into the skills and superpowers that they have. One of the favorite parts of using the tool was the conversations that it generated and the insights the caregivers and patients provided for us. One patient said, "It's a good questionnaire for the mindset. This survey became an avenue to better understand why I get out of bed every day." Another caregiver told us, "Without focusing on it, I didn't realize how big of an impact taking care of someone has had on me. My empathy has expanded more than I could ever imagine." And another patient said, "I truly think SMA has made me a better person." And we hear the similar things about patients living with muscular dystrophies. The Ploos-Ogun family named their foundation the Hummingbird Fund because to see a hummingbird is to be surprised by joy. They note that a hummingbird is a reminder that no matter what our circumstances, there is joy and beauty all around us. And I really appreciate all the ways that they have helped me to see vision and meaning in the journey, and the ways that they have taught me about offering kindness and about seeking wisdom. We start our visits asking patients to name what they're hopeful for each day. We ask patients, "What are 3 things you're hopeful for today?" And I find that that allows us to decide what we're going to focus on for each visit. We also end each visit with a questionnaire about hope. And this has allowed further conversations about what's most important for each patient and caregiver during that visit. And we try to put a focus on strengths and superpowers to bring these to light for our community. I'm grateful for what Jim and Peggy, my patients, my colleagues, and all of you in this room as well, have taught me about seeking wisdom and offering kindness on the way to finding light in the journey. I'm grateful that we can walk this journey together, and I thank you all for the ways that you're continuing to advocate for this community. So thanks for allowing me to tell you about our experiences, and I'd love to continue the conversation about using the turbocharged living tool that the Ploos-Ogun family has developed in this PPMD community. I also want to say thanks so much to our wonderful clinic team at University of Virginia. This is our neuromuscular team there, and as I know so many in this room know, we can't do this without a multidisciplinary team, without PTs and OTs and nutrition and social work and nursing and wheelchair specialists and everybody in the room, research coordinators who really make our clinic thrive. And thanks so much to all of you who inspire us to look for kindness and hope and light in our lives. I really appreciate PPMD seeking to highlight this here at this conference and also just holding this whole conference. It's such a great place to be able to connect with other families and connect with colleagues and to be able to learn from one another. Thanks to the Plews-Ogan family who've taught me a lot about wisdom, and also to our UVA Kids Muscle Clinic team. I've learned a lot from so many. Thank you all.
Thank you so much, Dr. Scharf. That was wonderful. So if anybody has questions for her, please come up to the microphones. I'll start off if that's okay. I'm curious how your families have been, how they've reacted when you've approached them with this tool. I think, you know, it can be a lot when you're in clinic and you're seeing lots of different doctors and therapists, and there's lots of different surveys and questions and all of these different things that people are asking. And this is another tool, but it's such a different tool. Can you tell me a little bit about what that receptivity has been like?
Yeah, absolutely. So I agree, clinics are crazy. I'm sure you all know this even more than I do, but it's busy. And we, like many of you, have a full multidisciplinary team, so patients are often seeing many different providers in one day. We try to get this in between visits or right before the start of a visit, and so it is one more thing to fill out. I do think that most of our patients have been very positive about it, especially when we are telling them the backstory of why my colleague Jim Plews-Ogan had created this during his journey with ALS. And I think that it can be really helpful for me as the physician going into the room to know what patients are thinking or just ask them what's on their mind. And so I've appreciated that. It is busy. I always wish we had more time in clinic, for sure. But I think pausing for a few moments to reflect on some strengths can be a nice way to take it through. Yeah, great question. Hi, Svisha.
Wonderful job.
Thank you.
My question is this questionnaire ever been done remotely? Is that possible to be able to do it to bigger community to use it?
Yes, I love that question. So the question is, has it been done remotely? And we have done it a few times. So we've done it over the phone a few times, and we've done it over Zoom a few times, or in a telemedicine visit. And I actually think that's probably a good way to go forward, because it might take out some of the busyness of being in clinic and still allow patients, or you could even perhaps mail it ahead of time and then just have someone bring it back with them, which could also save on that very busy clinic day. But yes, I think it would be neat to be able to use it in many clinics, because it's provided me with a lot of insight about my patients. Yeah.
Have you done sequential questionnaires for same patient to see the changes?
Correct. Yes, we have. And so we have just started using this over the past year. So we don't have lots of years of data yet, but we have. And I have found it's very different. We get very different answers if a patient is closer to a diagnosis or if been living with a condition for 10, 20 years. And so that is also interesting perspective, I think, to add. But some of our families have told us, yes, I felt this way when we were first diagnosed, and now that we've been doing this for a year, we feel differently, or we've learned, or we've found these supports. And so it is interesting, I think, to watch patients go through that journey.
Thank you so much.
Thank you. Yeah. Any other questions?
Not really a question, but just a comment to say that I love how going in and asking them, what are they hopeful for, instead of saying, what are your problems, or what are your questions, just changes the whole attitude of the appointment. And so I just think that's wonderful.
Absolutely.
Makes it more positive. So
yeah.
Thank you.
Thank you for that comment. And I should note, we are actually now also doing this down at Duke's ALS and neuromuscle, and actually Parkinson's clinics down at Duke. So it's UVA and Duke as well, which has been nice. Yes, go right ahead.
I was just curious to know if your patients don't have hope or newly diagnosed, what kind of conversations you have or what type of resources you give them in those situations.
Yeah, excellent. And I think that's really important to note that there's not a right answer here, right? Your answers could be, things are hard right now, and I think that's valid, right? And so I really appreciate that. And I think what I like about this is sometimes patients don't always tell me they don't have hope, if we're just in the midst of discussing their medications and their cardiac meds and stuff. So this also allows a chance to pause and talk about that, which I appreciate. And so that's a really good thing. It allows us to then say, okay, what are the resources? Who could you connect with? Can we call PPMD? And can we talk to the social worker? Are there resources we can provide for support? Because it's overwhelming at first with a new diagnosis. And I think it's important to acknowledge that and to also then think about what are the resources that may be helpful, because a lot of my patients do tell me things get better, as time goes by, and or things go up and down, which is also, I think, normal and valid. And so I think that's the time to then seek out those resources, those supports that are really critical for all of us. Everybody needs supportive community. Love that you asked that. Thank you.
Hi, thank you very much. I thought that was wonderful. So, one of the things with the clinics and the guidelines is that everyone should have some time individually with the physician or the social worker. And sometimes people say, well, what we talk about, what if hot topics come up? But this might be a good way of facilitating those conversations, to have that time alone, one-on-one. At what age do you usually start administering this? Just curious, and whether that's something you do with the parents or without.
Great question. We're new into this, just a year, so I would say all good things for consideration. I have found that this is very helpful for caregivers often, and sometimes I think we almost need caregivers alone in the room too, which can be helpful. But we can do this down to children as young as 4 and 5. We have an oral version that allows us to ask. It's a similar theme questions, same topics, but it's differently worded to make it a little more simple for kids. And then we can just give it to teens and adult patients as well as caregivers. So it can span the whole range pretty much. And if we are alone in the room with a teen or older child, teen or young adult patient, then we can certainly, and I agree, this is a great way to start conversations. Yeah, thank you.
I have another one.
I'm ready.
One of the things that was mentioned in the teen and adult care breakout yesterday was the importance of, in the adult care landscape, finding a physician who cares to help really quarterback that care. And it doesn't even matter what their subspecialty is, but finding somebody who really cares to help anchor that care team. And so I was just thinking about the way that, good gravy. Thanks. Short little Rachel over here. Anyway, I was thinking about finding that physician who cares, and it is very evident that you deeply, deeply care about your patient population. I'm curious how administering this test has changed how you care for your patients. How has it changed the way that you counsel your patients and navigate sort of the way that you approach conversations kind of at a baseline level?
Right. I think I have the privilege, like I think many neuromuscular docs, of knowing my patients fairly well, and I get to know about ballet recitals and siblings being born and vacations and all of that, which is the great thing about getting to know a patient over time. But this has also really allowed some reflection on what are those strengths, what are those things that you are really good at, or what are those things that are harder, and we should think about some more resources. So it's just allowed a little bit more perspective. And I think it could be given by anybody, and so in one of our clinics, the speech language pathologist is the one who is talking through the survey on the adult side, and I think that's wonderful, and it could really, I agree, highlight some strengths or allow for more conversations with any of the providers in clinic, which I think is helpful. But I found that a lot of my patients have also just found, for self-reflection, it's neat to stop and think, wow, I've learned a lot, or yeah, there's a lot of things I can do that contribute. And so I think that has been also a highlight of this tool. Yeah. Good. Well, thank you all very much. I really appreciate the chance to share about it, and I appreciate you all being here. Thank you.
All right, thank you so much again, Dr. Scharf. We really appreciate it.